Parkinson's disease. Parkinson's disease is a reformist sensory system issue that influences development. Side effects start bit by bit, at times beginning with a scarcely observable quake in only one hand. Quakes are normal, however the confusion additionally ordinarily causes firmness or easing back of development. In the beginning phases of Parkinson's infection, your face may show next to zero demeanor. Your arms may not swing when you walk. Your discourse may turn out to be delicate or slurred. Parkinson's illness side effects deteriorate as your condition advances over the long haul. Despite the fact that Parkinson's illness can't be restored, drugs may fundamentally improve your indications. Sporadically, your PCP may propose a medical procedure to control certain areas of your mind and improve your manifestations. Side effects. Parkinson's infection signs and indications can be distinctive for everybody. Early signs might be gentle and go undetected. Manifestations regularly start on one side of your body and typically stay more awful on that side, even after indications start to influence the two sides. Parkinson's signs and side effects may include quake. A quake, or shaking, normally starts in an appendage, regularly your hand or fingers. You may rub your thumb and index finger to and fro, known as a pill-moving quake. Your hand may shake when it's very still. Eased back development, bradykinesia. Over the long run, Parkinson's sickness may moderate your development, simplifying undertakings troublesome and tedious. Your means may become more limited when you walk. It could be hard to escape a seat. You may dawdle as you attempt to walk. Inflexible muscles. Muscle firmness may happen in any piece of your body. The firm muscles can be excruciating and limit your scope of movement. Hindered stance and equilibrium. Your stance may get stooped, or you may have balance issues because of Parkinson's infection. Loss of programmed developments. You may have a diminished capacity to perform oblivious developments, including squinting, grinning or swinging your arms when you walk. Discourse changes. You may talk delicately, rapidly, slur or waver prior to talking. Your discourse might be even more a droning as opposed to have the standard enunciations. Composing changes. It might turn out to be difficult to compose, and your composing may show up little. When to see a specialist? See your PCP on the off chance that you have any of the indications related with Parkinson's infection, not exclusively to analyze your condition yet in addition to preclude different reasons for your side effects. Causes in Parkinson's infection: certain nerve cells, neurons, in the mind continuously separate or pass on. A large number of the manifestations are because of a deficiency of neurons that produce a synthetic courier in your mind called dopamine. At the point when dopamine levels decline, it causes unusual mind action, prompting disabled development and different manifestations of Parkinson's illness. The reason for Parkinson's infection is obscure, however a few variables seem to assume a part, including qualities. Specialists have recognized explicit hereditary changes that can cause Parkinson's infection. Be that as it may, these are extraordinary besides in uncommon cases with numerous relatives influenced by Parkinson's infection. Be that as it may, certain quality varieties seem to expand the danger of Parkinson's illness yet with a generally little danger of Parkinson's sickness for every one of these hereditary markers. Natural triggers. Openness to specific poisons or natural variables may build the danger of later Parkinson's infection, yet the danger is moderately little. Specialists have likewise noticed that numerous progressions happen in the cerebrums of individuals with Parkinson's illness, in spite of the fact that it's not satisfactory why these progressions happen. These progressions include the presence of Lewy bodies. Bunches of explicit substances inside synapses are minuscule markers of Parkinson's sickness. These are called Lewy bodies, and specialists accept these Lewy bodies hold a significant piece of information to the reason for Parkinson's illness. Alpha-synuclein found inside Lewy bodies. Albeit numerous substances are found inside Lewy bodies, researchers accept a significant one is the characteristic and far-reaching protein called alpha-synuclein, a synuclein. It's found in all Lewy bodies in a clustered structure that cells can't separate. This is as of now a significant concentration among Parkinson's illness specialists. Hazard factors for Parkinson's illness include age. Youthful grown-ups once in a while experience Parkinson's sickness. It conventionally starts in center or late life, and the danger increments with age. Individuals generally build up the illness around age 60 or more established. Heredity. Having a nearby relative with Parkinson's illness builds the odds that you'll build up the infection. Be that as it may, your dangers are still little except if you have numerous family members in your family with Parkinson's illness. Sex. Men are bound to build up Parkinson's illness than are ladies. Openness to poisons. Progressing openness to herbicides and pesticides may marginally build your danger of Parkinson's illness. Difficulties. Parkinson's illness is regularly joined by these extra issues, which might be treatable, thinking challenges. You may encounter psychological issues, dementia, and thinking challenges. These generally happen in the later phases of Parkinson's illness. Such psychological issues aren't extremely receptive to meds. Gloom and enthusiastic changes. You may encounter sorrow, some of the time in the beginning phases. Getting treatment for sorrow can make it simpler to deal with different difficulties of Parkinson's sickness. You may likewise encounter other enthusiastic changes, like dread, uneasiness or loss of inspiration. Specialists may give you drugs to treat these indications. Gulping issues. You may create troubles with gulping as your condition advances. Spit may aggregate in your mouth due to eased-back gulping, prompting slobbering. Biting and eating issues. Late-stage Parkinson's illness influences the muscles in your mouth, making biting troublesome. This can prompt stifling and helpless nourishment. Rest issues and rest problems. Individuals with Parkinson's infection regularly have rest issues, including awakening often for the duration of the evening, getting up ahead of schedule or nodding off during the day. Individuals may likewise encounter fast eye development rest conduct issue, which includes showcasing your fantasies. Meds may help your rest issues. Bladder issues. Parkinson's illness may mess bladder up, including being not able to control pee or experiencing issues peeing. Clogging. Numerous individuals with Parkinson's sickness create stoppage, chiefly because of a more slow stomach-related plot. You may likewise incite circulatory strain changes. You may feel bleary-eyed or dizzy when you remain because of an unexpected drop in circulatory strain, orthostatic hypotension. Smell brokenness. You may encounter issues with your feeling of smell. You may experience issues recognizing certain scents or the distinction between smells. Exhaustion. Numerous individuals with Parkinson's infection lose energy and experience exhaustion, particularly later in the day. The reason isn't constantly known. Torment. A few group with Parkinson's sickness experience torment, either in explicit spaces of their bodies or all through their bodies. Sexual brokenness. A few group with Parkinson's sickness notice a diminishing in sexual longing or execution. Anticipation. Since the reason for Parkinson's is obscure, demonstrated approaches to forestall the infection likewise stay a secret. Some exploration has shown that standard high-impact exercise may diminish the danger of Parkinson's illness. Some other examination has shown that individuals who burn through caffeine, which is found in espresso, tea and cola, get Parkinson's infection less regularly than the individuals who don't drink it. Green tea is likewise identified with a diminished danger of building up Parkinson's illness. Notwithstanding, it is as yet not known whether caffeine really secures against getting Parkinson's, or is connected in some alternate way. As of now, there isn't sufficient proof to propose drinking energized refreshments to ensure against Parkinson's.